Welcome to the Hospital Emergency Management Program course. This training describes a comprehensive emergency management program, explains why it is important, and discusses effective program development and implementation strategies. The following information also serves as a baseline for understanding the Hospital Incident Command System, or HICS. While this course is written as if your hospital was starting from the beginning, most organizations have long had an emergency management program and emergency operations plan. It is a simple matter to use this material to refine existing programs. Healthcare facilities are required by accrediting and regulatory authorities to establish and maintain effective emergency management programs. These programs should utilize best industry practices and focus on comprehensive emergency management as well as community-wide integration and interoperability. Comprehensive emergency management is a dynamic process that recognizes that effective emergency management is much more than merely reacting to a problem. Rather, it is the managerial function charged with creating the framework within which one's vulnerability to hazards are reduced and ability to cope with disasters enhanced. A hospital's emergency management program is composed of a number of critical elements that are relevant to the 4 phases of emergency management: mitigation, preparedness, response, and recovery. Mitigation, the first phase, includes activities taken to harden the facility against the occurrence of an emergency or to minimize to the greatest extent possible its impact on hospital operations. The second phase, preparedness, encompasses actions taken to get ready for an emergency. Response includes actions taken to save lives and prevent further property damage in an emergency situation. Finally, recovery measures are activities following the emergency that help the organization return to its pre-crisis state. Examples of emergency management actions are shown in the left column. Drag and drop the examples onto the phase they represent. Emergency management activities should be considered from an all-hazards perspective. Specific plans for likely events or critical actions are useful, but overall planning should be applicable to any incident or event. This ensures that unpredictable occurrences are managed just as effectively as those a hospital can foresee. A major component of an effective emergency management program is community-wide collaboration. No facility is an island. For example, consider the need for a hospital to evacuate. If it has not included other community resources in its planning, where will their patients and employees go? How will they get there? And what can they expect in terms of maintaining clinical services? The 2 key elements for a successful emergency management program are integration and interoperability. Integration is the process by which a facility plans as a part of a larger community. This is best accomplished through an organized community-wide planning process that involves all associated stakeholders. Most communities have an emergency management agency that is charged with emergency planning. Hospitals are large stakeholders in this process, so they should work hard to ensure their facility-specific plans fit in with those from their community. While integration is the key to effective planning, interoperability is the critical element in effective response. Interoperability simply means that all response elements are able to interact, coordinate, and communicate to most efficiently address a common threat. 2 major components of interoperability are effective communication and the use of a compatible incident management system. Communications are the key to effective control and coordination of any emergency response. Most after-action reviews of incidents point to communications as an opportunity for improvement. It is important that hospitals ensure that their communication processes and technology merge well with those used in their community and with those healthcare providers within or affiliated with the institution. The importance of using compatible incident management systems has led to a nationwide effort to develop a system that enables all responders, healthcare providers, and public safety agencies to function together. The result is the National Incident Management System, or NIMS. Developed by the U.S. Department of Homeland Security, NIMS integrates effective practices in emergency preparedness and response into a comprehensive national framework. One of the key components of NIMS is a requirement that all emergency responders use the Incident Command System, or ICS. It only makes sense that hospitals also use the same system. Most hospitals use an adaptation of ICS known as the Hospital Incident Command System, or HICS. By using HICS, hospitals ensure that the command system they are using links seamlessly with that used by other emergency responders. This streamlines the community-wide response to a crisis and enhances command, control, and the coordination of resources. Effective planning must also involve cooperation among all the healthcare organizations in the community. Hospitals should share facility-specific information that is critical to responding to healthcare emergencies. This collaborative approach allows a community to maximize resources and minimize the effect on any one healthcare facility. Cooperative agreements should be reached and documented among all the hospitals, clinics, urgent care centers, freestanding surgery centers, physician offices, ambulance providers, extended care and skilled nursing facilities, home health agencies, hospices, and others. These measures will prove vital for coordinating both emergent and non-emergent incidents and events such as an influenza outbreak, natural disaster, hospital evacuation, or preparation for a community-wide sporting event. There are three major activities that are the essence of creating a successful emergency management program. These are gaining organizational support, program development, and implementation. From the outset of emergency management program development, gaining organizational support is critical. Hospital administration must be committed to devoting the resources required to build and sustain a comprehensive program. There are several parts to this commitment. They include designating an emergency program manager, establishing an emergency management committee, and providing a budget. In addition, administration must allow for meaningful staff time dedicated to training, exercises, program evaluation and improvement, and sustainment of the program. There must be a mandate from the hospital leadership that provides the emergency planners with support and authority to be effective. The appointment of an experienced, qualified, and motivated individual to serve as the emergency program manager is vital. This individual facilitates all of the hospital's preparedness efforts and typically represents the hospital at various preparedness meetings on a local and state level. The emergency manager should ideally have formal training in emergency management and be certified in the field. Part of gaining organizational support is ensuring that all facility stakeholders are involved in the program. A designated emergency management committee should be established and chartered. The mission of this committee is to prepare, implement, and coordinate the organization's emergency management program. In addition, this committee should annually conduct a hazard vulnerability analysis, or HVA, and update their emergency operations plan to reflect the hazard identified. The committee should also author incident-specific guidance along with hospital continuity of operations plans. Community integration, sustainment, and evaluation of the program are also essential roles played by the Emergency Management Committee. Most hospitals already have disaster committees whose membership includes many or all department heads. This means there could be dozens of members. While every department may have a role in an emergency, it is difficult to effectively develop a program with this large of a committee. Therefore, a more focused emergency management committee is recommended. It is the committee's responsibility to make sure that all stakeholders have input. A senior executive should serve as the administration representative on the Emergency Management Committee. This individual, while not necessarily the emergency manager, should have policy approval and funding authority, which will ensure that the program does not bog down awaiting executive approval to move an initiative forward. The committee should also consider including external response agencies, if not as full participants, then at least as coordinating elements. Such representatives may include emergency management coordinators from neighboring facilities, public health officials, EMS, police, fire, and other local emergency planners. Finally, a hospital's emergency management program should have a budget or cost center allocated. Too often, emergency program expenditures are covered within one or another operating department's budget, making it difficult or impossible to determine the actual cost of the program. For the program to be effective and ensure sustainment, a budget should be developed, funding should be allocated, and costs should be tracked. Another pillar of creating a comprehensive emergency management program is development. With the Emergency Management Committee in place, a critical review of existing plans should be performed and augmented into a full emergency management program. Some basic steps include hazard assessment, resource evaluation, policy and procedure development, and mitigation and preparedness activities. A basic first step of developing an emergency management program is assessing significant internal and external hazards faced by the hospital to help prioritize risks and focus preparedness efforts. A common tool used for this purpose is known as the Hazard Vulnerability Analysis, or HVA. An HVA is generally done in 3 steps: listing hazards, determining probability of occurrence, and rating the hazard's impact. HVAs use a formula, which may vary in depth and complexity, that ranks vulnerability based on facility-assigned probability and impact ratings. This results in a vulnerability score for each risk. The highest vulnerability events then become the point of focus for mitigation efforts and preparedness activities. A key consideration is that impact is offset by preparedness. This assessment should be reviewed annually. As an example, consider a fire in the facility. The probability of one occurring is at least moderate, so on a scale of 1 to 4, it is assigned a value of 3. The impact of a fire could be significant. However, since all employees are trained in fire safety, the facility meets all fire safety codes, and the local fire department is well trained and responds quickly, the level of readiness moderates the impact. It is assigned an impact of 2. As the table shows, the vulnerability to a fire is calculated as a 6. This is greater than the vulnerability to direct hit of a tornado, so more resources are devoted to preparing for a fire. Next year's HVA may show different scores, and preparedness activities may shift to another risk. After assessing hazards, the committee should conduct a candid analysis of the organization's strengths, weaknesses, and opportunities for improvement in the current incident management process. This may be derived from experiences during an actual event or recent exercises. Another helpful evaluation tool is benchmarking promising practice organizations, either within or outside the community. These organizations use methods or processes that have consistently shown results superior to those achieved with other measures. Learning from case studies of actual incidents or events allows hospitals to understand what works and what are the pitfalls. Once hazards are assessed and resources are evaluated, the committee can get down to the business of developing its emergency management program and Emergency Operations Plan, or EOP. The Emergency Management Program, or EMP, articulates the mission, vision, goals, and objectives of the organization as it relates to emergency management. The EMP utilizes hazard analysis, planning, decision-making, and assignment of available resources to mitigate, prepare for, respond to, and recover from all hazards. The EOP provides the structure and processes that the hospital uses to respond and initially recover from an incident. It is the response and recovery component of the EMP. Critical areas that should be addressed in the EMP include incident recognition, alerts and notifications, and triggers and authority for EOP activation. Staff and departmental responsibilities, communications, staffing, credentialing, and volunteer management should also be addressed. In addition, key topics should be planned for, such as safety and security, logistics, resource management, finance, and emergency spending authorizations. Finally, incident-specific issues or needs, such as evacuation, decontamination, fatality management, and loss of community support plans should also be developed. After determining how the hospital is going to conduct emergency management, actual efforts toward mitigation and preparedness take place. Mitigation may involve facility or policy changes that lower the potential impact of an emergency. For example, a coastal hospital in a flood zone that raises its emergency generators to an upper floor so they don't become flooded in a storm surge has taken a mitigation step. Preparedness will include training staff, drilling and emergency procedures, and implementing the hospital incident command system. Once the hospital has formally adopted the emergency management program and EOP in principle, implementation becomes the next step. Adequate time allotment, effective team process and group participation, and managing expectations throughout the organization are important at this stage. An effective emergency manager can positively influence many of these factors through the committee process. At the outset, realistic expectations must be set for implementation. Modern emergency management, especially when using the HICS model, is far-reaching and affects every aspect of the organization's crisis operations. Developing this program will take time, so the committee must understand that from the outset. Most organizations will take between 6 and 12 months to fully convert to a HICS-based paradigm for emergency management. In order to maintain focus and momentum, a clear work plan and timeline should be developed to aid the emergency management program implementation process. Subgroups of committee members may be assigned to work on various pieces of the process. By regularly demonstrating progress against the timeline, the process will be clearly defined and frustration will be minimized. Program formats and assignments may be varied among committee members and subgroups to maintain interest in the program as it evolves. Members should be encouraged to contribute their expertise. Several challenges may still be anticipated at this point. These include concerns about the organization's actual readiness and the common organizational tendency to be comfortable with the status quo. Strategies for this stage of the project should be consistent with the hospital's philosophy of change management. About midway through the project, a date for HICS implementation should be set and publicized, which will serve both as a commitment motivator and an anticipation builder. An incremental approach may be effective as well. For example, schedule implementation of the model first in the emergency department. The committee should consider tying implementation into an external activity, such as a disaster exercise or community appreciation day. Timing is always worth considering. For example, September is National Preparedness Month. Implementation may also be linked to a personal emergency preparedness program. As the hospital shows employees the importance of personal preparedness, it can be tied in with organizational preparedness and the eventual shift to the comprehensive HICS-based emergency management model. This connectivity can help ensure holistic awareness, interest, and sustainment. After development and implementation of the EMP is complete, it is time to test and evaluate the program. This is ideally done during lower stress drills and exercises. A series of smaller drills will fine-tune the process as well as emphasize the usefulness of HICS for the full spectrum of response. As competence increases, so should the complexity of the exercise. Each exercise should be followed by a full debriefing and review with remedial actions identified and assigned. Follow-up is critical if the committee wants credibility with the administration, hospital staff, and community partners. All exercises should follow a standardized format and approach to their design, development, and execution. Instead of conducting an exercise simply to meet accreditation requirements, your hospital should design and orchestrate training opportunities that assess and challenge clearly defined objectives. These objectives, such as incident recognition, plan activation, use of HICS, and medical surge, need to be SMART, specific, measurable, achievable, relevant, and timely. These guiding principles for exercise programs are part of the Homeland Security Exercise and Evaluation Program, or HCEP, developed by the U.S. Department of Homeland Security. This program addresses both the management of an exercise program and the execution of individual exercises. Using this process helps validate plans, test operational capabilities, maintain leadership effectiveness, and examine ways we utilize community partners. The ultimate test of an emergency management program comes during actual incidents. Each response should be viewed as a continuation of the program development. Full reviews and follow-up are just as critical after implementation as during, and are part of sustaining the program. Sustaining the vitality and relevance of an emergency management program requires ongoing investment and leadership development coupled with constant practice and refinement. It is a cyclical and ongoing practice that can bring significant cost savings to the organization when efficiency and process improvement are incorporated into the foundation of the hospital's EMP. Incorporating the program into the hospital's quality management and efficiency improvement processes and establishing a measurement tool for HICS performance best accomplish this. While it may not always be effective to quantify or score response actions, there should be some objective measure of performance. Using the HCEP to develop objectives for any drills, workshops, or exercises allow a hospital to see progress on specific areas of your emergency management program. Constant quality improvement in emergency management should be just as important as other measures in the hospital. Progressive, high-performance healthcare organizations will proceed to benchmark with other organizations, further ratcheting up their standards and expectations. This course has described the components of a comprehensive emergency management program, including mitigation, preparedness, response, and recovery. The essential stages in creating a successful emergency management program include gaining organizational support, program development, and implementation. The typical hospital uses a committee to do most of the actual development and counts on the facility as a whole to implement the program. Testing and evaluation using the HCEP process are critical to refining and sustaining the program. Sustainment is ongoing and every bit as important as development in making a hospital's program as good as it can be.